Hey everyone, welcome to the Freedom to Flourish podcast. I'm Dr. Joel Miller here with my co-host, Dr. Tim Augustiniak. Today we're talking about annual exams. We're talking about lab tests, mammograms, colonoscopies, pap smears, prostate exams. We're talking about what's actually needed, what's actually necessary, and what are the general recommendations that we'll hear from our doctors. And so part of the inspiration for this episode has been patients asking about like, hey, do I really need to do an annual exam with my primary doctor? And a lot of times they'll also ask, do I really need to do a mammogram? Do I really need to do a colonoscopy? So we're going to talk about all of those. And as I was talking here with Dr. Tim, I realized people are asking these questions because we have essentially developed such a distrust with our doctors, and so a lot of times, of course, whenever you find a doctor that you like or appreciate, you'll ask them, hey, what are your thoughts? And so that's what we're going to share here today is our thoughts on some of these things. So Dr. Tim, I'm sure you've gotten this question from time to time as well. Let's kind of jump in with things and talk about, like, maybe start with what are the general recommendations from kind of your average primary doctor as far as what an annual exam or annual labs looks like. And then, of course, we can get into, maybe where we think there's actually maybe ways that could be better and what labs actually should look like from kind of a holistic standpoint.
Yeah, I think it's important to mention before we get into all that stuff. This episode, just like you said, inspired by what patients ask, all those things. But quite honestly, it's also inspired by certain decisions that I would argue some of my patients have made that I wouldn't have made the same choice. There's certain things that happen along the way in practice that you can't really predict. And the only way to know about things that are going on internally for absolute certain sometimes is to do these tests. I mean, I'm sure you remember back when we were going through seminars with Dr. Gangemi, we talk about the only way that we can detect with the systems healthcare technique, the applied kinesiology, that there is a problem is if things are affecting the nervous system. If the nervous system is not affected by what's going on, then you just won't find it. And so there's no way to know for certain if there are cancers or things like that involved. Unless there's a significant irritation to an organ. And even then, you still can't know that it's cancer without lab testing and proper diagnosis from a medical doctor. And so, anyway, we're going to talk about pros and cons of all these screens and kind of our take on things. And then also, I would like to add some examples of patients that I've recommended to get these tests because from my perspective, as a chiropractor, that is not something that scope of practice warrants us to say, hey, no, you don't need that testing. That's just not a place for us to say. Now, our goal and our job is to properly educate our patients. And if they still choose to make a decision that we wouldn't do ourselves, then that's on them. We did our job. So, but let's get into it. So with what we tend to recommend, I mean, doing an annual exam, always good. You need to know, is your heart rate, blood pressure, your vitals, how are those things doing? Is your weight staying consistent? And with doing an annual exam, you can see trends, because if you're putting on even 3 pounds a year, give it 10 years, that's 30 pounds, and so keeping on top of that and understanding that, weight gain happens, things happen, and, your health can very gradually start to go downhill a little bit if you're not staying on top of things. A physical exam every year can help you stay on top of that and understand that that's an issue. Now, with that, a typical physical exam at an annual physical is going to involve things like your vitals, height, weight, blood pressure, temp, heart rate, all those things. And then if there's issues there, obviously they need to be addressed. But then from there, there's also the actual like visual inspection that whatever doctor is performing it can see, do you have any varicose veins in your legs? Is there swelling somewhere? Do you have bags under your eyes? Are your eyebrows thinning? Like what's going on? Is your skin looking pale? Like maybe some anemia stuff. The visual exam or the inspection is very, very important with seeing if there's any problems. Palpation is another portion where, Say there's abdominal pain of some sorts that you weren't aware of unless somebody pushes on it, indicating maybe a pancreas issue, some maybe mono, maybe your spleen is enlarged, something like that. Or maybe there's liver issues where, there's elevated liver enzymes, and then palpatory findings indicate that there's some sort of swelling with the liver. You never know until you get your hands on somebody. Auscultation, listening to your heart, listening to your lungs, making sure that there's no, bruits or murmurs or things like that may come up, especially as, things progress later in life. A lot of times cardiac issues creep in, a lot of times pulmonary issues creep in, and just screening that annually, definitely a good thing. I mean, it's not invasive at all. And then neuro exams. I mean, a lot of times, not a lot of times, but people get things like MS or degenerative neurologic issues where having a sufficient neuro exam is super important, because if you get, say, bilateral lower extremity neuro findings, it could go along with poor circulation down there, poor blood flow, lots of swelling, and it could indicate some cardiac issues and things like that you need to get ahead of. So all in all, I mean, you need to have hands put on you every year. People need to feel what's going on. They need to listen. They need to gather some data on what's going on with your body. And that's only the physical exam side of things. We need to have a look inside with some blood work as well. And so the best way to see what's going on internally in regards to just getting a good overall health perspective on stuff, to see where things are at, is through just getting some good annual labs. And so we kind of put a list here on our note. Dr. Joel, I would love to hear if you have anything else to contribute beyond what I had put on here. But I guess to quickly go through the list, you have your CBC with differential. That is, generally speaking, kind of an anemia panel. You see your red blood cell markers and things like that. But you also see your white blood cells and the types that are present. So you can see if there's immune system issues as well. Along with that, your comprehensive metabolic panel, lipid panel, all of those things to look at blood sugar, to look at cholesterol, all those things to see if there's any dysfunction there. Iron/anemia panels, just looking to see if iron's low, and looking at B vitamins along with that to see if there's deficiencies there that can lead to certain types of anemias, lead to fatigue, things like that. Vitamin D levels are super important. And honestly, one of the biggest things that is not run by medical doctors, overwhelming majority of the time, is a full thyroid panel. And so if they even run anything thyroid on annual labs, it'll typically only be TSH, which is your thyroid stimulating hormone. And that's just the hormone that the pituitary secretes to tell the thyroid to make more hormone. But along with that, we can measure thyroid hormone output. We can measure antibodies if there's an autoimmune issue kicking in. We can measure enzymes and things like that. We can measure all kinds of stuff. And so with doing that, we can get a good picture if there's some sort of functional hypothyroid issue, if there's autoimmunity, if there's Graves' disease, if there's a conversion issue. There's all kinds of stuff that we can gather information from with that goes beyond just a TSH level. The next thing on the list is CRP, which is just a general inflammatory marker. Homocysteine, I would argue, kind of goes with that same category, where it measures your antioxidant status. So when homocysteine goes high, antioxidants go low, and methylated B vitamins and all that stuff goes low as well. And beyond that, insulin, A1C, getting a good look at how blood sugar is doing, because just your blood glucose is just a snapshot in time. We like to see a longer term measurement of that. And honestly, hormones are a great thing to look at too, just to see where you're at, make sure you're on a good trend, and accompany that with all the metabolic stuff and inflammatory things that could be present on labs. If hormones are off, usually those are the things that are driving in metabolic issues, insulin, and then from there, some inflammatory things. So all in all, I mean, I would argue this is probably a very comprehensive list if you're just running things every year. Of course, there's other stuff you can get into, but all in all, this gives you a very, very, very good overlook on overall health. So, but Dr. Joel, what do you think about this list? Is there anything you'd add and contribute to that?
Yeah, I think this list is great. I think in general, Dr. Tim, what most patients are used to is going in for kind of their annual exam, and the doctor says, "How you doing?" And maybe they have some different complaints, maybe not, but they run some labs, and of the labs, like what we've given here, Dr. Tim, and what you've walked us through, is a very comprehensive list of blood work. What most patients are getting from their annual exam with their primary doctor is maybe 4 or 5 of these tests. It's usually CBC. A lot of times it's without differential, which means they'll look at the white blood cell count, but they won't look at the breakdown of what parts of your immune system are at what percentages and so forth, which is literally a difference of $2, and it's very helpful information, I would say. And then they might do a basic cholesterol panel. They might check the A1C, and then they might check TSH. And so it's such a bare minimum panel that I tell patients it kind of gives you a little bit of information, which is good, but it also generally leaves you with a lot more questions. And so what I encourage patients is once a year, run a comprehensive panel, which if you're paying out of pocket, that might look like around $200, depending on where you go and that kind of thing. But you can run an extremely comprehensive panel for $200, and that will show you everything, all the things that you just walked through, and give you so much more information. So again, I find that patients generally are complaining that their primary doctor is not super thorough. The tests are pretty minimal, and they usually kind of get brushed off if they even have any complaints. They don't feel like it's really that necessary. But I also think a lot of it revolves around what's the expectation of what an annual exam looks like. I've heard patients talk about how they kind of thought, okay, well, if I go in for an annual exam, that means they're going to look at my skin. They're going to look at all my skin and tell me, just check to make sure I don't have some kind of skin cancer developing or something like that. And that's not necessarily what happens. That might happen if you have an annual exam with a dermatologist, but kind of with a general checkup with things, most of the time doctors say, how you doing? And here's a few labs. And then usually the nurse calls or somebody and says, hey, everything looks good. Which is most people that have been through that know that it's not necessarily the most, it's not the best way of communication there. Usually there's things to be talked about on the labs, and a lot of times things kind of tend to get brushed over and things like that. But overall, Dr. Tim, I think this list is great. I think in general, and what I recommend is, I think getting some kind of exam once a year is great. Like you talked about, weight, blood pressure, heart rate, temperature, stuff like that. Obviously, you can do a lot of that stuff at home. You can take your blood pressure at home. Obviously, you can gauge, kind of track your weight and stuff like that. But also, I think finding someone that tends to do a more thorough job is really good. And then, honestly, I would say, Dr. Tim, we've talked about how a lot of this is a conversation, and which means it's not necessarily a one-size-fits-all. And so for each person, I think it's really good to do many self-exams. What I mean by that is, keep an eye on your skin. Every once in a while, just kind of look in the mirror at your skin and just make sure there's nothing kind of developing or growing that you think might look abnormal or not, might look suspicious. If you're a female, kind of doing a self-breast exam. If you're a guy, doing a self-genital exam. I think those things can be just good to do every once in a while. And, most of the time, I think if you just kind of pay attention to what's going on with your health, with your body, symptoms you're having, and don't ignore those things, then you can know if you need more lab testing, if you need more exams, or not so much. So again, kind of a little bit of a gray area there, and kind of a conversation for each person. But going back to the blood work, I think that's great. And like I said, I recommend people do just a really good comprehensive panel once a year. And the worst case scenario, you're spending $200 and you're being, getting that confirmation that things look really good. Worst case scenario, you spend $200 and you realize oh, well, man, there's some things off here. And because we did the comprehensive panel, I know it's related to the hormones, or I know it's related to, whatever may be going on, blood sugar and stuff like that. So I think that's really helpful, but also having someone reading the labs that actually understands kind of how to read comprehensive blood work and kind of understand how the body's functioning based off the blood labs. I think that's also super important. So, Dr. Tim, that's pretty much all I've got to add there as far as the blood work goes. And again, I think it's a good idea, but really just make sure it's comprehensive, and make sure that the person that's reading it can understand what numbers that are off are important to address and what maybe kind of the root of it is. I definitely, Dr. Tim, I'm sure you've run into this. I definitely do not recommend having labs ran and then just Googling all of the results, because sooner or later, Google will tell you have cancer, and it's just, it leads to a lot of stress and a lot of anxiety and things like that. So again, having someone in your corner that's holistic, that understands how to read labs comprehensively, I think is really, really important. So
Yeah, 100%. Patients, we'll do it too. You Google something that's going on and you're like, oh man, cancer. But the whole clinical thought process is not, oh, let's think the most extreme thing and the least likely thing as being, in our case, the most likely. The clinical thought process is take all the information that you have based on timing, signs, symptoms, labs, physical exam findings, all these things. And from there, accompany that with statistics on how likely certain things are and how common they are. And so, if you've got, just a chronic cough or something like that, after getting sick, it's probably not cancer. It's probably just some sort of lingering infection that your immune system's struggling to get rid of. It could be allergies, could be all kinds of stuff happening at once. But the thought shouldn't immediately go to, I'm going to die because of this, because the likelihood of that is not great. I mean, how many people get a cough from getting sick that die compared to people that just get a cough because they're sick? Like the cough is probably just because of a virus or something.
right.
But you brought up something that I think is very important to talk about, because I figured I would bring this up later on. Self-screening and self-examination. So the American Cancer Society no longer recommends that women do a self-breast exam. They asked to stop doing that a couple of years ago. And the reason for that is more recent research was showing that there is a increase in not false positives, increase in anxiety and unnecessary testing for masses that were not cancerous and were normal fibrous tissues. And so the logic there that I was reading on is, one, there's more women that are seeking screening for things because they were doing that, and overwhelming majority of the time there's nothing wrong. It's just normal fibrous tissue. They just don't know what they're feeling for. And so just because there are, masses, or not, I don't want to say masses, but things that you can feel in the breast tissue, little nodules, things like that. I mean, there's stuff all over our body that you could probably poke around anywhere and find, oh, there's a little lump there, or there's a little lump there. And it's just normal variants that we all have within our tissues. And so I don't know if anybody's ever, palpated around their stomach, armpits, where there's lymphatic tissue, fat tissue, all those things. But there's a lot of little nodule type things. I mean, fat cells, adipose tissue, all that stuff. It'll form these little nodule type things. And if there's lymph nodes along with that, if you've been sick in the past that caused lymph swelling that never went down, there's all kinds of situations where you can find things that are not big problems. And so, given that the American Cancer Society recommends that, and there is great research that shows that it's not helpful for outcomes, and it actually contributes to, I guess, more issues than good. I don't think I would be comfortable recommending that most of the time. Some women just do it anyway, and I inform them of that, and they do their own research and do their own things. But I mean, how often are you performing a breast exam, Dr. Joel?
I don't.
You don't, exactly. And so even with us being trained to do those things, the confidence level that we would be able to have to actually find something that was clinically significant and know the difference between something that actually feels like it's a problem versus something that's normal that we feel all the time, it's not there, And if you were doing your own exams at home, your baseline is yourself. It's not like you've gone through and just palpated a bunch of different patients that actually have cancerous nodules versus not. That is one thing with, medical residency and all those things that's very, very important for their physical exam skills with that is they just get their hands on way more people and do those actual exams. Within our training, we're trained to do it, but we don't get that same hands-on experience with that part of physical exam. we get plenty of it with other palpatory things and, actual like auscultation and just the whole gambit of physical exams. But when it comes to the more specific ones like breast exams and genital exams, all that stuff, I mean, we've absolutely been trained. We have done all those things on real people. It just is not something that, along with our training, we did it a million times on real people.
Yeah.
So anyway, do what you will. The whole point of this episode is to educate you guys on um, what things to consider with this stuff. If you want to do your own exam, great, go for it. But just understand that there's research that shows that might not be the best idea because you don't know what you're feeling for the most part. I mean, if you do know what you're feeling for and you have been trained in that, great. But that's a little different than somebody who hasn't, So anyway, that's my
Yeah.
2 cents on that.
Yeah.
But let's get into the tests and things to screen for and everything, because there's a lot of tests where doctors will argue screening's not great because it leads to false positives, it increase in catastrophization of issues that normally wouldn't be worried about, and so it leads to worse health outcomes in the long run. So depending on what you're screening for, I think it's important that we talk about differences there. So
Yeah, absolutely. And Dr. Tim,
anyway.
real quick, I just want to mention, just to tag on another 2 cents to that conversation of like, hey, self-exams, are they worthwhile? I definitely, I think there's like this overwhelming theme that we see, which is maybe there's a lab test done, maybe there's a little bit of a self-exam, and people, their anxiety goes through the roof. And we live in one of the most anxious societies probably that's ever been. And I think that's its own problem in and of itself. But I think there's got to be, I would say, maybe a middle line. And again, this is for every person to continue forward with and make their own choice on this. But there's got to be a middle line of like doing some kind of self-examination, but also being, I would argue that would be more beneficial in the long run, because as you do that, every time you learn a little bit more about your body. And if you can start younger, 20s and that kind of thing, then by the time you get to 30, 40, 50, if something was to develop, you would know like, hey, that's actually not normal and that hasn't been there before. And so I think that there's some kind of maybe written or mentioned benefits with that. But even if you do that, I would recommend definitely, working with someone that, does an exam, and just kind of, if you're concerned about anything, go have them check it out. And if they say, oh no, that's normal. Okay, great. Then just realize, oh, that's normal tissue. So I think that I think examining without, the anxiety and all that, I think can have benefits long-term as you just get to know your body more. But anyways, that was just kind of the last thing I want to mention as part of that conversation. That maybe is helpful there. So,
yeah. What do you say starts off with talking about some of the other exams that we're going to be getting into, or testing that we're going to get into?
Yeah, let's do it. So let's talk about mammograms. So we'll do mammograms. We'll get into pap smears, colonoscopies, prostate exams, all that good stuff. There is a lot of talk around a lot of these. There's probably more talk around the mammograms and their necessity compared to like pap smears. But here's what I find, Dr. Tim, there is like an extreme medical approach with all of these, which is you need to do these exams like all the time. And I'm being a little bit facetious with some of this, but you need to do these exams annually or every other year, that kind of thing. And then there's like this holistic side, which I think is too much sometimes, which is like, no, you never need these exams. Like you should, and it's kind of like, it's just like such an opposite swing, right? It's like, no, these things are going to cause you all these problems. And I think sometimes that can be an entertaining perspective to look at and listen to sometimes on other people's podcasts and stuff like that. But I think there's a middle line. And that middle line, I think, should be based off of understanding the risks and benefits, which is going to require kind of educating yourself a little bit, but then also understanding like who generally should probably be getting this exam. So in general, with like mammograms, it's like the general consensus as I was researching through some of these things is that can mammograms catch cancer? Yes. Um, can mammograms catch cancer super well? Maybe not super well. It does miss things, but one of the biggest issues with it is this overwhelming thing we do see a lot of, which is like over medicalization of things, which means like if you get all these labs and all these tests done so often, and if you're looking for, here's the big thing, if you're looking for something that's gone bad, you might just find it, whether it's there or not, and that leads you down a journey and a road of being over tested, being over treated, being overdiagnosed. And we know that, um, like medical treatments is one of the top 3 leading causes of death in America. And so there's got to be a balance of like what's necessary and what's needed. So in some of the research that I came up with here, so here's some interesting numbers. Out of 1,000 women screened with mammograms for about 10 years, 1 to 2 deaths are prevented. 100 to 200 false positives are produced, meaning they're told that they have something going on there and they end up not. And then 10 to 20 of them are overdiagnosed cancer, which means essentially they're told, oh, we think this is cancer. And then it turns out, oh no, it was benign. It was a fibroid or something like that. And so again, some of these numbers just to show you like, no, they are helpful. I mean, they saved 1 or 2 people's lives out of the 1,000, but then there was a ton of people that were kind of overdiagnosed and given a ton of anxiety and probably had a lot more tests done than they needed and stuff like that. So just want to mention some things there, but then also a couple of other numbers here is mammograms will miss about 10 to 20% of breast cancers. And it's actually a lot higher in women with dense breast tissue. It's higher up to 40 to 50%. And so again, just kind of going to show like it can be helpful, but sometimes it can create more anxiety and it can sometimes miss things and that kind of thing. Dr. Tim, personally, with a lot of patients, I'll talk with patients and tell them, should you be worried about the radiation? And I would say if you're using a microwave at home, you're getting way more radiation, over the span of days and weeks and so forth than you're going to get from a mammogram. Should you be excited about the radiation? No, we should actively work against radiation in general. But I think if you're at an increased risk, I think that's something that you should consider. And at the same time, if you're at a decreased risk, meaning, you're younger and generally very healthy, don't have hormone issues, things like that, then I think that is something that I don't think you should necessarily feel pressured into doing that. Now, with that said, Dr. Tim, and I'm curious if you have any other thoughts to add here. One thing that I love to recommend for women that I really think is probably more beneficial is actually a thermography scan. So a thermography scan is basically where they take a picture of your body that measures the temperature of your body in different parts. So what we find with that is where you have increased inflammation and increased cellular activity, which is essentially what happens with cancer, is these cells are multiplying and replicating and growing so quickly. Thermography is going to be able to catch those spots of increased temperature, which might be able to indicate like, hey, there's some more inflammation here and there's more cellular activity. I don't have the numbers on that percentage wise and as far as, how that compares to mammographies and so forth, or mammograms, I should say. But in general, I've had a number of patients that will get those, and it's just really good information to be able to see the inflammation of, number one, your whole body, but also comparing breast to breast. And then also if that's something you do every year, every 3 years, every 5 years, you can always look back and compare them and see what's happening. It tends to be just helpful to see things from a different perspective, more of a cellular perspective, looking at the inflammation there. So, Dr. Tim, any other thoughts to add to mammograms there?
No, I think you about covered it. That, honestly, of all the tests that we're going to talk about, is the one that most women that come into the office forego.
Yeah.
Mainly because, like you said, 1 in 10 or 1 in 5 women are going to have false positives. Yeah. And so that's a lot of wasted cost, and it's a lot of wasted time and anxiety. And all that stuff. So, just not good for health outcomes at all. So, But let's get into pap smears. So
Yep.
pap smears, I'm completely pro pap smear. So
Okay.
pap smears have reduced cervical cancer rates by over 70% since they were started in the mid 1900s. And so, with that being the case, I mean, it just like colonoscopies, I'm kind of on the same page with colonoscopies. All things considered, risk is pretty dang low. And things are caught early before they actually have a chance to develop into something cancerous. So a lot of the masses that are found or issues that are found in both of these things are considered precancerous, and they will eventually develop into cancers if they were not found and treated effectively. And so that alone, given that it's low risk for any issues for the most part, there's not any radiation involved, any of that stuff. All in all, I mean, I think they're great. I mean, there's other things that can make pap smears more likely to have problems and basically make you more susceptible to issues. But that's mainly like sexual issues. No, I don't want to say issues, but numerous partners, things like that, STI risk, all that stuff where HPV may be positive and present, all of those things. But all in all, I'm pro pap smear.
Yeah, that's good thoughts. Good thoughts, Dr. Tim. I would say I'm probably a little bit more conservative with some of that approach in the sense of, pap smears in general are considered way safer than mammograms. They're considered way more effective. Some of the things I was finding with some research was that the pap smear alone can give you, 50 to 75% sensitivity, but then doing that with the HPV testing gives you a much higher sensitivity, around 90 to 95%. And so just realizing like, okay, the cervical cancer a lot of times is somewhat triggered by these viruses, the HPV viruses. And so, just understanding like, hey, that's that connection is there. And so checking for those viruses and that kind of thing can be very helpful. I think with pap smears, I think in general, the holistic approach is like, is kind of understanding like a lot of those viruses, like if you do get them, they generally clear up over time. But also if you're dealing with different viruses like HPV, especially, you're going to have more warts on your skin. I think that's important to understand as well. So I think just understanding, the numbers do, I think, show a lot as far as like, hey, these have really helped decrease cervical cancer by a lot, and it's helped a lot of women. And overall, the risks, I think, probably are not there as much physically and chemically. Although I do, I'm not necessarily a proponent of putting instruments inside the body unless it's really necessary. And then with that said, I think the likelihood that that's really going to cause issues is very, very low at the same time. So the most holistic approach is like, hey, we don't want to put anything in the body. And I generally tend to lean that way anyways. But occasionally, if you're at an increased risk based off of HPV infection and things like that, then you definitely should, I think, consider that occasionally. So, and at the same time, Dr. Tim, it's like, okay, well, if we have this, like, let's strengthen your immune system. And let's jump into muscle testing and figure out what your immune system needs to actually get rid of these viruses and to get rid of any issues here. So I think I would kind of just kind of limit some of my thoughts to that. Is it really needed? Are you at an increased risk? And if it's needed, I don't think it's necessarily a bad thing. There's worse things. I think sometimes, Dr. Tim, people can have so much stress around maybe the negative effects of something like a pap smear, which generally are very small. They can have so much stress about it that it actually causes them more health issues than actually getting the pap smear. So I think there has to be a balance with some of that.
Yeah, I completely agree. Now, the last two, colonoscopies. So colonoscopies, like I said, I am for the most part pro. I've actually had some circumstances with patients with some pretty significant GI issues that I recommended they go get one, and some of them kind of forewent it, and that still makes me wonder if they're going to have problems later on. But all in all, incidences of colon cancers have gone down by about 50%, generally speaking, since colonoscopies became kind of routine. Depending on what age you are, family history, other risks, or things that'll put you at risk for it, there's different recommendations about when to start those and how often to get them. If you've got Crohn's or ulcerative colitis or something like that, they recommend you start like between 20 and 30 years old and getting them every 1 to 2 years. Now, if you don't have any familial history, no risks, no symptoms, usually it's starting around like 40 to 50 and only getting them every 10 years. And so greatly variable, but think of it where inflammation is present and there's constant tissue rebuilding that has to go on, that provides more chances for cells to grow into cancers. So excess tissue growth equals excess ability for things to grow into cancers. And so if you have something where you have bleeding, chronic hemorrhoids, obviously significant gut inflammation like Crohn's, IBS, all those things, your risk for cancers are going to go up. And so consulting your primary care about when you should probably start that, not the worst idea. And with finding these precancerous polyps very, very early, and colon cancer being a very slow growing thing, I mean, the deaths by colon cancer have decreased by 60 to 70% ever since colonoscopies became a routine thing. And so just knowing that alone, and there being, relatively speaking, very few risks. I mean, there's the prep where you have to flush everything out, which just obviously is not very fun. But beyond that, I mean, yes, there's the chance that there's introduction of some sort of infection or something like that if things aren't necessarily sterile in the environment that you're at. But you could screen and just do some research about the hospital that you're going to, and just make sure that you're finding a good, reliable place to get those things done. And just read reviews and talk to people and figure out if that's the right place to go. And if you do your due diligence, I mean, the positives are really the primary thing that they have going on, just to see if there's any problems. So I recommend them. I'll be getting them later on, just because some, family history of things and stuff runs in the family, and just some GI issues that I have myself. And so I think it's important, and my peace of mind is going to be fulfilled by getting those done and knowing that I'm doing what I can to stay healthy and not get colon cancer. But, if you don't want to, at the end of the day, it's your choice. But this is one that I definitely recommend. And if patients have chronic issues, I'll really, really push for this stuff, because I've had very few patients that have issues downstream of this, but it does happen where they're like, yeah, ever since I got that colonoscopy, I've had crazy problems, and it's been difficult to treat those things. And so does that happen a whole lot though? Not really. I mean, I've had a handful of those in practice, maybe like 2 or 3. And so it just doesn't happen exceptionally often.
Yep.
So
yeah, that's good, Dr. Sim. Yeah. I align with your stance quite a bit, maybe a little bit more conservative, but I think if people tend to have more chronic gut issues, or it's in like their family history and in general, maybe not the healthiest, I recommend you probably should get a colonoscopy every 5 years or so, just to kind of check things as you get older, 50 years and above. But in general, if you're really healthy, if your gut is healthy, and there's not really a history of it, you don't really have gut symptoms, bloating, diarrhea, constipation, stuff like that, then I generally don't, I'm not so sure they're necessary. I personally don't plan on getting any colonoscopies, but that's assuming my gut health is good and all that fun stuff. So, Dr. Tim, prostate health and the prostate examination, then we got to wrap up here. So in general, it tends to be something that kind of gets overdiagnosed and overtreated more than necessary. There's a lot of weak evidence that we've kind of found that that the prostate exam, the digital rectal exam, is really helpful at catching cancers. And in general, Dr. Tim, what I find is your PSA, the prostate specific antigen, which you check on blood tests, that's going to increase early and significantly whenever there's something developing there, and the size may follow. But if the blood test is going to be something that we can depend on, I usually tell people check that once a year, and that should be a really good place to be.
Yeah, I agree. And I don't remember if it was the American Medical Association or some sort of other organization that kind of sets guidelines. I would bet it's more so like urology or something like that. But they went from recommending your annual digital exam plus your PSA to just doing the PSA, and they weren't doing those for a while. And then from there, they reincorporated the digital exam with it. And so, there are things that can cause swelling of the prostate that you can only detect through manually feeling. And I mean, beyond that, PSA is a great measure. Like you said, if there's cancers, things like that, you're gonna have an increase there. But it doesn't always happen immediately. And I think that's why they encourage the digital exam. But even still, the research, there's one study that we were able to find that said that, there was a 20% decrease in mortality due to prostate cancers. But even then, the evidence was pretty weak in that study, and there's not really any others that indicate one way or the other. And so do what you will. I mean, it's not exactly the most pleasant thing to get done, but it's simple. It's just a quick digital exam plus a little bit of blood work, good to go. So a lot of times you're going to be experiencing genitourinary symptoms prior to there being problems. So difficulty urinating, weak stream, pelvic pain, all that stuff. So anyway, I'm not sure if I'll do that later on. We'll see how I feel.
Yep, for sure.
But that's not a significant one that I push. Now, if patients come in and they already have some sort of prostate issue, that's a different story. So, but anyway, hopefully this has been a helpful episode for everybody. Dr. Joel, do you have anything else to add, or can we wrap things up?
No, I think I think all of these topics, I think in general, as a foundation, I think getting a good comprehensive, roughly $200 blood panel, $200 to $250 every year, I think is a great idea to get a good look at things, but also track things over time. Outside of that, I would say definitely depends on how at risk you are and what your health looks like. If you don't need it, I don't recommend it. And if you tend to be at a higher risk, I think it's better to be kind of safe than sorry potentially and get those things. But as always, I recommend trying to stay in a place of peace with everything, and not become over anxious with everything that can come at us.
100%. I agree. All right. Well, let's wrap things up. So I'm Dr. Tim Augustiniak here at Flourish Functional Wellness Center down in Bentonville, Arkansas. If you're going to find me online, the website is flourishfwc.com. Links to all the socials and all the contact info for the office is on there. And so if you have any questions, comments, concerns, or suggestions for future episodes, feel free to reach out and let us know.
Yep. Awesome. And I'm Dr. Joel Miller. The practice here is Freedom Health and Wellness in Flower Mound, Texas. You can find me online at drjoelmiller.com. If you guys have any questions or any suggestions for future episodes, feel free to reach out and let us know. We hope this is helpful for you guys, and we'll see you guys in the next one.